Okay, good evening, everyone. Welcome to this evening's webinar or today's webinar, depending on where in the world you're joining us. So my name is Scott. I am one of the founders of VTX, and I'm a specialist in small animal internal medicine, but I won't be saying huge amounts this evening. We're very pleased to be joined by our wonderful speaker, Frédéric Gaschen, who will be leading our session this evening. We're very excited to be working in collaboration with Protexin Veterinary to bring you this webinar this evening. So really excited to be here and really excited about this session and this topic. Just a little bit about Frédéric. So Frédéric is a graduate of the University of Bern in Switzerland and is a diplomate of the European and American College of Veterinary Internal Medicine. After teaching at the university in Bern in Switzerland, he moved to the USA a few years ago, and he's now a professor of small animal medicine at and actually chief of service at Louisiana State University in the US. And he has a particular interest in gastrointestinal disease, but I think, most interestingly, recently our new understanding of gastrointestinal disease generally, our move away from using antibiotics in a lot of these cases, and our kind of knowledge, I suppose, about other ways of managing cases in this area, I think is really interesting. And I think on the surface, how interesting can fiber be? But the answer is very interesting. And so we're excited to learn more about that this evening. So just a few kind of housekeeping things from our perspective. If everyone can make sure that they remain muted and they keep their videos off for the presentation, please feel free to ask any questions at any time, pop them into the chat, but do not, we won't be saying those out loud at the time of the presentation. We'll save those to the end. And if you have any technical issues, then do drop something in the chat to our colleague, the wonderful Naomi, and Andy will be here to help with that if you have any problems. And there will be a CPD certificate that will be available at the end, and we will share that in the chat. So without further ado, thanks everyone again for joining, and I'll hand over to Frédéric.
Fantastic. Well, thank you very much, Dr. Kilpatrick, Scott, for this nice introduction. I'm so happy to be here and grateful to Protexin for inviting me to give this seminar, and also grateful to Veterinary Thought Exchange for hosting the seminar. So, as Scott alluded to, there's a lot of new stuff happening in the world of gastroenterology in small animals. And today we'll talk about one thing we're rediscovering. It's really the use the use of dietary fiber in many of these cases. So let me just go there. These are my disclosures. I don't think they're going to impact what I'm going to tell you today. I wanted to be sure to have a quick disclaimer here that what I'm saying today is my own, and I'm not dragging anyone with me in case if they don't agree. My employer, Louisiana State University, or Protexin Vet, who is really making this webinar available. So perhaps we could start with a question to the audience. And that question is, how often do you consider dietary fiber in your approach of dogs with GI diseases? And so the answers are listed here, and please participate as honestly as you want to be. Is that something you do rarely, occasionally, relatively frequently? It's a little bit of an icebreaker, right? But also it gives me a chance to see who I'm talking to. And so I see a number of people are answering.
So we've got about 50% of people have voted, and we'll give it just another few seconds.
Sure. And Scott, I can see it. So
oh, you good? Okay.
Yes. Cool. So that's cool. Yes. So anybody who wants to participate is free to do so. And we I'm in a group of fiber connoisseurs where we have, I want to say, most of the people, it's pretty divided, right? Have used it 1/3, a little more occasionally, another third, a little less, maybe relatively frequently and frequently. So that's fantastic. But that will help me a little bit in where to go from here. So I guess I will move to the next slide the best way I can. There it is. We are going to talk about fiber, to kind of the basics, and it's an accelerated review. I want to add maybe another disclaimer. I am not a nutritionist. I'm a small animal internist. So a nutritionist would probably go at this talk a bit differently than I'm going to go at it, because they would know much more about the intricacies of dietary fiber than perhaps I do, in all honesty. So it's a good idea. Now everybody uses some type of artificial intelligence. I asked ChatGPT, my good old friends, describe to an audience of well-informed small animal veterinarians what dietary fiber is. So I was right on the audience based on the little poll we had. Then GPT told me it encompasses a diverse range of plant-derived compounds, often complex carbohydrates that resist enzymatic digestion in the small intestine, but which can have significant effects on gastrointestinal function, composition of the microbiota, and metabolic regulation altogether. So that seems pretty accurate. And here I like graphs. They speak more to me than too much text. And you can see here that dietary fiber can be divided in different categories. Okay, there are the fibers that are really going to be very non-digestible, such as lignin. You can see it on the lower left quadrant. It's present in the cell walls of plants and in seeds. So not super digestible. Resistant starch is something we'll see in a minute what it consists of. We have resistant oligosaccharides such as inulin, fructo oligosaccharides, and galactosido oligosaccharides, which are truly prebiotics because they do have an impact on the microbiota. They're going to actually potentially influence the growth of particular microorganisms. And on the left side, the non-starch polysaccharides that come in variable solubility, fermentability, and viscosity. That's where we find our friend psyllium that I'm sure we've all used at one time or another, but also many other fibers that are present in fruit and vegetables, etc. So as we move on, I'm not going to talk a lot about resistant starches today. They would be present in unripe bananas, raw potatoes, but also in beans, lentils, and whole grain altogether. The fibers are characterized based on some of their properties. Fermentability is one of them. So it measures how microorganisms that get to the large bowel are metabolized by microorganisms that are present there, so the large bowel microbiota. Typically, the more fermentable a fiber is, it's going to have an effect in decreasing the GI transit time, the fecal bulk, and increase the short-chain fatty acid production. More on that in a couple of slides. Solubility describes the fiber's ability to disperse in water, enabling a formation of a viscous gel in the gastrointestinal tract. So soluble fibers will slow the GI transit time and increase the viscosity of the content by binding water, versus insoluble fibers are more like bulking agents that will stimulate peristalsis and potentially accelerate the transit time. So this table from a recent article in Journal of American Veterinary Medical Association, shows the different properties: fermentability on the left and solubility at the top. And you can see highly fermentable and highly soluble fibers would be fructose, galactans, and you can read the list here. Many of them will be present in fruits, for instance. Then moderately fermentable and moderately soluble, we're going to find some pomaces, pea hulls. And then if we go to low fermentability, moderate solubility, we find our friend psyllium again, but also further to the right in low solubility, you'll find cellulose and other components of various plants, legumes, etc., and grains as well. So one thing that fibers really add to the health equation is their ability to lead to the production of short-chain fatty acids. Okay, so they get undigested, the small intestine is here to the left, they get to the large intestine undigested, and there they are confronted to the gut microbiota. So we know the gut microbiota is that gigantic physiological organ that is not really made of our cells, not at all actually, but it's absolutely super important. And for many reasons, one of the things it does, some of the microorganisms are going to produce short chain fatty acids out of these complex carbohydrates that are the fibers, and those consist of acetate, propionate, and butyrate. Butyrate is going to be used on site as a fuel for colonocytes. It's going to help colonocyte ensure their function properly. But we'll get back to that in a second. I'm not going to talk a whole lot about microbiota today because we're really focused on fiber, but it's so difficult to talk about fiber without talking about microbiota. It's so difficult to talk about GI diseases without talking about microbiota these days. And so the microbiota especially the gut microbiota, all the microorganisms that are hosted in our pets, in our dogs' intestines, and particularly here in the large bowel. And they have, as I said, very many essential, they accomplish essential functions for the health of their host. Metabolic functions, so we see these short chain fatty acids, they synthesize vitamins, and a variety of other things. They help actually preventing the growth of pathogens in the intestine. They have an effect also on the immune system, and they help maintain the intestine, particularly the intestinal barrier, which is so essential to separate the intestinal contents, so the outside world from the inside world on the other side of the mucosa. So the short chain fatty acids that are produced by the microbiota in the large bowel using the fiber substrate are important. As we say, that's the butyrate as an energy source for colonocytes. They increase mucus production and maintain the intestinal barrier function. So important, right? If this doesn't exist, then luminal components are going to get into the mucosa, and they activate the innate immune system and then the whole immune system in general. They help in acidifying the colonic lumen, thereby decreasing the chances of pathogenic bacteria to attach and cause trouble. They modulate the colonic microbiome, particularly the prebiotic fibers. And they generally induce a tolerogenic state in the mucosal immune system. So it's just the opposite through regulation of T cell and promotion of regulatory T cells, just the opposite of pro-inflammatory, really anti-inflammatory properties. But what's fascinating is it goes much further. You could all imagine, oh, well, I can see fibers are good for the GI tract, but they go much further through different receptors located on the colonocytes. They have an effect in general on the immune system. They also lead, and that effect is anti-inflammatory. They lead to the production of enteric hormones that will have a variety of effects. GLP-1, quite a famous one these days, decreasing, slowing down the transit, for instance, GABA and serotonin having an impact as neurotransmitters. There is an effect also on the liver, the fatty tissue, and then ultimately even on the brain. So good fibers are going to have an impact on neuronal function and the blood-brain barrier. So I find that it's phenomenal that that they're basically one of the components that activates the gut-brain axis. So in our pets, I'm coming back on Earth after all this excitation about what fibers can all do way beyond the GI tract. Let's get back to our pets and particularly our dogs, okay? So we know, and we've known for a while, that fibers may improve glycemic control, right? There's been diets that have been recommended for use in dogs with diabetes mellitus that are fiber enhanced. We also know that they may be an important part of a plan to have an animal lose weight, overweight animal lose weight. They help, especially the prebiotics, excuse me, with gut microbiome health, short chain fatty acid production. They improve the immune system health and have anti-inflammatory effects overall. There is a lot of literature looking at what else they do beyond the GI tract. We briefly alluded to that. They will regulate the transit times, have an effect potentially on nutrient digestibility and alter nutrient availability, and then they have effects also on the feces per se, their volume, the frequency of defecation, and the consistency and moisture content of it. So there's a lot of good things. As we said, every compound that has positive effects is going to potentially have some negative effects as well. They seem to be fairly negligible in comparison to all the positive effects. But as I alluded to just a minute ago, they may decrease digestibility or absorption of nutrients. If you give too many of them or you change diets too abruptly, there is a chance that there might be excessive colonic fermentation leading to flatulence, borborygmi, increased defecation frequency, etc. And that's why the dietary fiber supplements, especially those that are not in the diet per se, but are given as an actual supplement, those should be initiated at the low end of the recommended dose and then increased based on the clinical response. Typically, feces of an animal that receives fiber are going to have that little rubbery appearance that you can see here. And this is a situation where fibers helped a dog with colitis. This is a situation where they didn't, where you can still see the rubbery appearance, but there is a core of liquid feces in the middle of it. The problem about fiber is it's not very easy to figure out how much the diet that the animal is getting, how much fiber that diet contains, okay? And typically, at least in the United States, there is one number that should be provided as an as-fed percentual number, is the crude fiber number. And that crude fiber is usually maximum crude fiber based on the AFCO requirements. And it really only encompasses cellulose and lignin, and really not it doesn't include most of the fibers that we're actually interested in for their positive effect. And so the trend really is to use that other value, total dietary fiber, or TDF, that's expressed in gram per megacalorie of metabolizable energy. And so that would include soluble fibers and insoluble fibers, and leave on the side the fibers we're less interested in. And so these numbers are available from the manufacturers, but they're rarely available on the bag of dog food. So looking at, well, number one, the best or the preferred method for supplementation of fiber is a fiber-enhanced diet. Okay, so supplements are good as well, but what nutritionists recommend most is maybe change the diet, and we'll see that supplements have their role to play as well. We have a few diets that I just took from 3 large manufacturers, be Hills, Royal Canin, and Purina, and I guess I'm just mentioning this as some information. I'm not affiliated in any way with any of these pet food companies. So very low TDF would be, you know, ID, so very low total dietary fiber, Hills ID, hydrolyzed protein diets from most brands, or elemental diets such as amino acid diets. They have very low total dietary fibers. Low dietary fibers would be diets such as Purina Pro-Plan EN, Royal Canin gastrointestinal low fat, or Hills DD. And I'm sure you use one or the other of these diets to manage some of your GI patients. Moderate or kind of mid-range total dietary fibers, 45 to 60 grams per megacalories, are Hills GI Bio, Purina Pro-Plan EN Fiber Balance, and Royal Canin Glycobalance. And then there are the high total dietary fiber diets, and those are the ones that traditionally have been used to promote weight loss in overweight animals. In terms of supplements, to be honest, in the last decades, we've used psyllium, and I don't need to ask, I'm pretty sure many of them have had your experiences with psyllium in different situations, and it's fiber that has interesting properties. We saw where it was located in terms of fermentability and solubility. And here are some dosages that have been recommended. Generally, you know, the idea is start low on your dosage and move up. But also beware that while canned pumpkin or green beans contain a lot of fibers as well, in terms of fiber efficiency, psyllium is the most concentrated product, right? To obtain the same amount of fiber as in 2 tablespoons of psyllium, you would need 3 cups of canned pumpkin or 8 cups of green beans. Just remember that, that there is a bit of a concentration factor that plays a role here. All right. Oops, there we are. And then mentioning commercial dietary fiber supplements, you know, since we're in a, you know, we're the guests of Protexin today, all of us, so they do have 2 products, and I'm listing here the Pro Fiber Advance. And so these are mixtures of fibers. Some of these fibers in there are proprietary fibers, you know, with a little registered trademark, but you can see overall that there is a bunch of different fiber containing elements here, oat, sugar beet, alfalfa, psyllium husk, linear cellulose, and you know, the list goes on. So these little pellets in that supplement really look a little bit like pellets you would feed to rabbits. But I can tell you out of my own experience that I don't think dogs really like pellets for rabbits, but they sure do like the Protexin pellets. I've had little issues with acceptability and appetence with these pellets in the last few months. So just saying, this is a balanced and supplement containing multiple sources of fiber as opposed to psyllium, which just contains psyllium, right? Let's talk about a case. Birdie. He's been ill, so 5-year-old male-neutered fox terrier has been ill acutely since last night and has had many severe bouts of bloody diarrhea in the night. Now he's lethargic and has no appetite. He's tachycardic, he's maybe borderline hypothermic, and that's not Birdie barking. These are my dogs. I apologize. I can't really change it this minute. So he had dry and pale mucous membranes and cold extremities, and his CRT was a little prolonged. Okay, so we see here that he had a high hematocrit in the red blood cell count. His white blood cells were slightly decreased, ever so slightly, and a mild left shift of the neutrophils. So evidence of acute inflammation and hemoconcentration associated with his diarrhea. We can see here that there is some mild increases in liver enzymes, probably secondary to whatever was happening in his gut, and evidence of azotemia, which turned out being pre-renal because his specific gravity was, at 1028 or 1030. So how would you treat Birdie? So you get a chance to participate, should you want to, and the options we have here is, we will all want to give this dog supportive treatment. So let's be in agreement there. Would you like to give that plus metronidazole, that plus probiotic, or that plus fiber? And we see a number of people here. It's kind of a little bit, the option that has most voices at this time would be supportive treatment and probiotic, right? And the other options, metronidazole or just a supportive treatment or supportive and fiber, share the rest of the load more or less. Excellent. So
we'll
yes,
give that
please,
maybe just a couple of, we'll just give that a couple of seconds and then we can end that. I was going to just also say to everyone, make sure you are asking any questions you have just now in the chat, and we can collect them for the end. So do make sure to ask any questions as we go along. Frédéric, I did want to just ask you quickly, you referred to yourself as a fiber connoisseur or something like that. You said something at the beginning.
To everyone as a fiber connoisseur based on the first poll we did, because everyone was already using some fibers. I am not. I mean, yes, I'm a fiber. I'm a lover of fibers in a way.
Yeah.
I was very happy that the audience was consisted of fiber connoisseurs.
So, okay, I like that term. Whatever you said was good. I'm going to class myself as a fiber connoisseur. I like that. Okay, we'll end the poll there, and it seems like well, I mean, there's people sort of answering in every direction, but
the
I think
probiotic people are winning,
majority
right?
seem to be going with supportive treatment and probiotic.
Excellent.
Yeah.
Excellent. Well, this is great news. There's never a wrong answer, right? But maybe there is after all, right? And so the thing I wanted to go over is really the fact that antibiotics are not necessary in a dog like this one. When I went to vet school, I was told, hey, if the dog has bloody diarrhea, you need to give that dog antibiotics, because otherwise there is the potential for abnormal permeability, the intestinal barrier is broken, you need to fight potential microorganisms getting into the bloodstream from the intestinal lumen. Well, it turns out it doesn't really quite work that way, even though it makes sense in some way. In that study out of Germany, they took dogs with acute hemorrhagic diarrhea syndrome, such as Birdie, or we used to call it hemorrhagic gastroenteritis, and they treated them, half of them with amoxicillin and half plus supportive treatment, amoxicillin clavulanic acid, plus supportive treatment. The other ones only received supportive treatment plus a placebo. And you can see that looking at this clinical activity index, they start, the higher the number, the sicker they are, right? They are very sick at the beginning, and they all get better pretty quickly until day 3 if they have antibiotics in red here, or if they receive only the placebo. What's really important is the supportive treatment. And so really, there is no need to give antibiotics to this dog, Birdie. And if there's been several studies duplicating these results. One other thing that occurs is if you give antibiotics to these dogs, then the proportion of E. coli that are resistant to amoxicillin and clavulanic acid in their feces will increase. So you might contribute to spreading antimicrobial resistance. On top of that, these antibiotics are going to have a major impact on the dog's own microbiome, which is already not in a great place following the intestinal disease, but it's going to be in an even worse place in the end. So there's been a review and meta-analysis from the European Network for Optimization of Veterinary Antimicrobial Treatment. And in most cases of acute bloody or non-bloody diarrhea, the literature does not support the use of antibiotics. If the dogs come with severe systemic disease, they do not respond to fluid treatment, and they have either major leukocytosis or leukopenia, then of course, if they seem to be having systemic inflammatory response syndrome or sepsis, then antibiotics are recommended, okay, and they should be administered parenterally. But this is a small minority of all these cases we see. So in most cases, so we know this is that. Now, I don't want to be negative Nelly here, but that same group said, based on the available evidence, they do not recommend the use of probiotics or synbiotics, which are a mixture of probiotics and prebiotics. There is just not enough data in the literature based on that meta-analysis to support it. So the jury is still out on that, right? The jury is still out. So if you decided to give probiotics, you are not wrong. In the United States, a recent study showed that veterinarians, when confronted with dogs with acute diarrhea of unknown origin, would resort to 40% dietary modification. And we're talking here about dogs with diarrhea, not dogs with diarrhea that are sick like little Birdie. 20% would resort to probiotics, 20% to antimicrobials. Some people would give antidiarrheals, and some people would just not do anything. If we look at how these treatments worked in the eyes of people that were using them, people using antimicrobials thought that they worked really very well. And I have to say, where I work, a lot of people, and not where I work at the university, but if I look at the area where I work, we see a lot of patients that eventually are referred to us or come to us for a second opinion that have received metronidazole, for instance. And I do think in most cases that was not helpful. Of course, I would see only those for which it was not helpful, otherwise they might not come and see me. But anyway, antimicrobials seem to work in the eyes of those who use them. Probiotics, people are, still a little torn as to do they work or not. Diet, people think it works well, and I think they're correct. Antidiarrheals, we don't use them very much, and benign neglect, most people agree that it doesn't work great, right? If we look at the other side of the ocean, recently at the ECVIM Congress in France a couple of weeks ago, a study was presented as a poster showing the number of veterinarians that are going to, the percentage of veterinarians that are going to use antibiotics in dogs with acute gastroenteritis. And you see that it started already very low compared to the United States, and now it's even much lower. So let's say 4% of cases would be treated with antibiotics, and it might just be those that actually need it because they're not doing well otherwise, and they have SIRS and sepsis, right? super interesting paper came out of Ohio State University a couple of years ago. And in that paper, they recruited dogs with acute non-infectious colitis, okay? So they had excluded parasites, and they assigned them to one of three groups, okay? And a group receiving, so about 20 per group, right? A group receiving an easily digestible diet, so that was all randomized, right? Easily digestible diet, and a placebo tablet. Another group that received that same diet plus metronidazole, that's group 2, that is in dark blue, and a third group that received a psyllium-enhanced, easily digestible diet with a moderate total dietary fiber, versus the other one had a low, the easy digestible diet for the other two groups had a low total dietary fiber. And then they looked at the number of cases in remission, a little bit like a Kaplan-Meier graph, right? And so at the beginning, no one was in remission. They were not doing great. But if we look here, group 1, which received just the easily digestible diet, EN type stuff, got better, pretty okay over time. And remission was characterized by no more diarrhea. The group 2, which received the metronidazole, seemed to actually get better slower than group 1. So there were less animals that were better, for instance, at day 5, and it took longer for 50% of the dogs to feel better, almost 9 days, versus with the other diet, it was like 5 or 6 days. And then those that received a psyllium-enhanced, easily digestible diet, they did even a little bit better than the ones that had received the easily digestible diet without psyllium. So we can see here that the group 2, which received metronidazole, tended to have more relapses over 30 days after being discharged. The group that looked like they had the least relapses was those receiving diet. But what was really statistically different is the metronidazole group compared to the other two groups. And if we look at the microbiota, here a measure of the microbiota called the dysbiosis index, measured in the feces, and that dysbiosis index should be less than 0 in the dark gray area here. And it was, notably increased, so abnormal, in the animals that received metronidazole group 2. Okay, so that metronidazole is going to mess up with the dog's microbiome. There were other studies showing the value of using fiber-enhanced diets in shelter dogs, where the dogs receiving fiber-enhanced diets recovered faster over a period of a few days versus those that received a easily digestible diet without fiber enhancement. Another study out of Germany that showed, again, the abnormal, like in dogs with acute diarrhea receiving metronidazole or a mixture of pre and probiotics, the dysbiosis index went up in the dogs receiving the antibiotics over time, even remained abnormal at 30 days after treatment was completed. And some taxa, some particular bacteria that are beneficial, such as that particular Clostridium, decreased in the metronidazole group in light gray versus the other group, and some bacteria that are less desirable, such as E. coli, increase in the metronidazole group, and that for certainly up to 30 days after treatment. So metronidazole seemed to have a bit of an cause a bit of a better improvement of clinical signs on day 3 compared to the symbiotic, but it causes dysbiosis. It caused dysbiosis for up to a month and decreased abundance of beneficial and increased abundance of less beneficial taxa. Birdie was discharged, actually did really well, was discharged 3 days after admission with symptomatic treatment. And we actually sent him home with a diet that contained moderate total dietary fiber. But we could also, he was there before we had access to the Protexin product, have sent him home with a little bit of psyllium or with ProFiber. That would have worked probably just as well. Another case here, Bear. Bear is a dog that had chronic intermittent diarrhea, 3-year-old male-neutered Labrador retriever, predominantly large bowel diarrhea with mucus, blood, tenesmus, was eating well, no vomiting, no weight loss, and he had no parasites. We even did a PCR fecal panel, and otherwise his physical exam was unremarkable. So the issue was honestly the bloody diarrhea. That's why the owners came and saw us. So we have here another little poll for you guys. What approach would you choose in Bear? Would you get blood work, a complete blood count, chemistry panel, urinalysis, or do that plus an abdominal ultrasound? Or would you initiate an elimination trial? Or would you measure resting serum cortisol concentration? So we have some people here. We're going to have to be patient a little bit until everyone gets a chance to share their thoughts. Right. So we see that the majority so far would like to have a minimum database plus abdominal ultrasound. That's about 45% of those who participated. About a third would like to start an elimination trial, and about a quarter, like 25%, would like to just do the minimum database with blood work and urinalysis. And then there's not many people who choose option D. So I don't know, Scott, if we can move on, or we'd like to
Yeah,
wait a
we
little
can.
longer.
No, that's fine. Let's end that there. So, it would seem like the minimum database and the ultrasound was the most popular answer.
Right.
Which is, yeah, I suppose by minimum database, do you mean like sort of hematology biochemistry type
Right, I
approach?
wrote it just
Yeah.
above, CBC,
Oh,
chem
sorry.
panel,
Oh,
urinalysis, and then
it was
enhanced with ultrasound.
sorry.
Don't worry, Scott.
No, that was it was, but the poll covered it up, so I didn't see it. Sorry. So
No
that's
worries.
great. Okay, yeah. So
So
yeah, that seems to be the
basically,
most
we
popular.
have actually 70% of the people who would like to do some type of diagnostic investigation. And I don't blame you, but I can tell you that this dog is the textbook picture of a dog that's going to have diet responsive chronic enteropathy or chronic inflammatory enteropathy. And we see that in general, in dogs with chronic diarrhea, we have between 50 and 75% of those dogs that respond to a change in diet in an elimination trial. The first paper was out of Switzerland. I was fortunate to be part of that, where we gave a novel protein diet that dogs hadn't seen before, but you can also, there's been other papers showing that hydrolyzed peptides would work just as well. So out of a paper from colleagues Al Jurgens and Romy Heilman, really, if you have a dog that has diarrhea, such as Bear, and is otherwise in good health, except for the diarrhea, it's going to have a low clinical index of disease, really. And these clinical indices, you can, if you want, scan that little QR code and you'll see what they are. And if there is really minimal to mild systemic repercussion of the diarrhea, then the way to go is initiate that elimination trial. And so I tell my students, you can save some money to the owners by not doing the blood work at that moment, not doing the ultrasound, because they're going to be fairly low yield procedures. I can tell you for bear, it's very unlikely they'll show much. And I feel even more strongly if I'm dealing with a younger dog, medium to large size dog with large bowel diarrhea. So the way to go here is the elimination trial, because this dog, in all likelihood, has diet-responsive chronic inflammatory enteropathy. And we can see here amongst dogs that have diet-responsive chronic enteropathy or food-responsive chronic enteropathy, many of them had large intestinal signs. Only a minority had a mixture of large and small, and a small minority, I apologize, had small intestinal signs. Other dogs that require use of steroids, or dogs with protein-losing enteropathy, much more commonly have small intestinal signs. So for bear, it was the diet. Okay, even at this time, if we give one diet and we expect a response within 10 to 14 days, significant clinical response. So if it's there, great. If it's not there, we are going to consider doing a second trial, as long as the dog is still in the same condition, doesn't have any systemic impact of its diarrhea. We'll go, perhaps if we use the hydrolyze first, we'll use a novel protein, or vice versa. Of course, if the dog is not doing well, then we need to go and perform blood work and abdominal ultrasound, etc. So there was a little study done by the people at Hills checking dogs with chronic colitis and administering Hills Biome to them. Biome contains a proprietary mixture of fibers. You can see whole grains, ground pecan shells, cellulose, flaxseed, and it goes on, right? They treated these dogs with chronic inflammatory enteropathy and large bowel signs with Biome, and obtained really good results as well. And so while we're waiting perhaps for papers or studies comparing different types of diets, Biome in a dog like bear or Purina EN fiber enhance and fiber balance, sorry, or Royal Canin equivalent might have been good options as well. And in conclusion, concluding, I'd like to briefly talk about chronic idiopathic large bowel diarrhea, right? We see that so these are these cases that have large bowel diarrhea, but if you were to go all the way to check their colon with a colonoscopy and endoscopy and histology, you wouldn't really see any inflammatory lesions. There are only minimal lesions. The signs, however, would be very obvious. And there were studies done as long as 20 years ago by Mike Lee, in Virginia, and you can see that many of these dogs have issues, personality traits that are different, or they're exposed to environmental stress factors. And if I talk to colleagues who work in the military, Air Force, for instance, or with police, the sheriff's department and such, that happens quite a bit in these working dogs, but also in dogs that are boarded, or in dogs that love to do agility, for instance, okay? And we know that these dogs respond exquisitely to fiber supplementation with psyllium. We haven't tried other types of fiber, but psyllium works. Fiber advanced from Protexin might work as well. And so there has been paper 20 years ago, and even as recently as a few years back, showing that you get between very good and good response in 90% of the cases after administration of psyllium. And if you stop the psyllium and they keep going on with their regular lifestyle, then the diarrhea will come back. Some dogs do not respond, and these are the dogs that would probably need a behavioral assessment, potentially to figure out how we can best help them. So dietary fibers, we've seen what they all encompass. We know that they may exert beneficial effects locally and remotely on our patients. The negative effects in comparison to these positive effects seem to be fairly negligible. We should think twice about using antibiotics in general in dogs with GI disease. Dietary fiber supplementation may be beneficial, especially if we're dealing with large bowel disease. And fiber-enhanced diet seems to be the preferred method at this time, but supplements can also be very useful in a variety of situations. And there's still a lot to be learned about fiber and canine GI diseases. We know that it may work, right? But what we don't know is what's the best mixture, what components are most useful with which for which particular disease. We know it works well in large bowel with cases of large bowel diarrhea. We suspect it probably has a role to play in dogs that have small bowel type of diarrhea, potentially even those with protein-losing enteropathy and other forms of severe enteropathies. So much additional research is needed, but I believe that where we are now is a place where I feel comfortable recommending fiber supplementation much more so than I used to. And that shows that I'm an internist. I think nutritionists have already recommended modulating fiber in the diet of their patients for a while. But now it's hitting the people that are seeing the patients as internists, as general practitioners and such. So I want to thank you all for attending, considering that it's kind of late in the evening for you, and I'm ready for your questions, Scott.
Well, thank you so much for the presentation. Really interesting, and I think there are a number of questions. I think that for me, I suppose just a couple of things kind of come through regarding that, sharing that data, looking at the use of antibiotic in cases of diarrhea, particularly acute diarrhea, and that sort of summary that we don't have huge amounts of evidence for things like maybe, probiotics, or even, still understanding what role fiber has to play. I suppose it always, for me, in some way, I don't, correct me if I'm wrong, comes down to that kind of, there's an element of do no harm. And we know that generally, fiber modification, probiotics are unlikely to do the same harm that giving antibiotics maybe would if we're using them inappropriately. I don't know, maybe is that fair, do you think? Would you agree with that?
I totally agree with you. I think, if we want, see, I'm gonna retire not too long from now, right? So for me, it's like, well, I've had it nice, right? But I'm thinking of all these students that I see every day at the vet school, so enthusiastic and so ready to go and all this. And I would like that they can still use antibiotics in their patients when antibiotics are needed. And I think that if I use a lot of these antibiotics in my GI patients, I'm in a way compromising that a little bit. So I'm trying, and then that's one aspect, right? But on the other hand, I'm also not doing a good thing for the microbiome in these dogs. And we don't know much about the long-term effects of messing with the dogs or a cat's microbiome. So it's data in human medicine that is a little concerning, to be honest. So overall, I try to think as many times as I can, and before I use them, and if they must be used, then they must be used. There it is. I guess, yes, there are situations where antibiotics are necessary.
Yeah. So a number of questions. So Sam Taylor actually asks about, the question is, what about dogs with small and large bowel disease? Is there any evidence of benefits of fiber in chronic small intestinal enteropathy, or any disadvantage? And actually any disadvantages potentially with the lower calories? And yeah, that's a great question. I think that, because I suppose I often think of for myself, large bowel diarrhea is maybe where fiber would play a role. But I think the question really is, what about the small intestinal? And many of our cases have mixed, so to speak,
You're right.
symptoms.
Good point. So about the calorie content, I think those fiber enhanced diets that have a lower calorie content are those that are going to be indicated for overweight animals. So I don't think we're at the point where we recommend using those for dogs with diarrhea, right? So we are more like in the area of what I mentioned, those that are moderately high total dietary fibers, such as GI Biome, to name a few, Purina, EN Fiber Enhance, and the equivalent was Walcanen. So now, back to the question, I have to say that in many of these dogs, they need a dietary trial. They need, and I'm talking now about those with mixed signs that don't have protein loss, that are only mildly perhaps affected in their general health. They need to be placed on a dietary trial. We often go with hydrolyzed protein peptides, and what I've done, it's very anecdotal, but I've used fiber supplements that are available, such as the Protexin fiber supplement, just thinking, well, there I'm not just giving cellulose, right? Something that's non-digestible. Well, I should say not fermentable and not soluble. I'm not giving them hay. I'm giving them something good with a variety of fibers that could have a beneficial effect. So we don't really have data to answer that question. Anecdotally, I've done it more than I used to, and I've sometimes been positively surprised, and sometimes I've been frustrated because it didn't work. So, but if I can, I will usually, especially if they're not systemically ill, sorry, I will go with fiber in addition to the proper diet.
Yeah, it's interesting. And I think also, I can't remember if you mentioned this, but I suppose there are some cases with chronic enteropathies where I think you made a really good point about that, shorter period of time to know whether a diet's going to be responsive,
Right.
that 10 to 14 days rather than 6 weeks or whatever we used to do in, ages.
And for what dermatology has to do, right?
What dermatology has to do, that's right, they still have to do that. But also, that idea that potentially if one diet doesn't work, maybe another will. So there's,
Right.
there's different ways of hydrolyzed versus novel protein versus maybe fiber modification. There's different ways, right, of doing it.
Yes, and so absolutely, I believe that the two trials, like implementing one trial, and if it doesn't work, do another one, provided the animal is not, the condition of the dog is not gotten worse in the meantime. This is really the way that most GI nerds, we talked about fiber connoisseurs, now I'm talking about GI nerds, which I would like to belong to, I think I belong to them a little bit, would recommend at this time. So definitely two trials, and there is literature to support that. But that was not the main topic of today's lecture.
No.
Right?
Yeah. Ellen asked a really good question, actually, and this is something that often get asked about when you're adding, and I think you've touched on this a little bit. Is ProFiber Advanced suitable for dogs on a hydrolyzed diet? And I think you did touch on this, but I suppose the addition of a fiber supplement or something on top of doing this hydrolyzed exclusion type diet or whatever, is that suitable to be adding things in?
So I guess, the question, there might be protein. I don't think there are many, but I mean, I believe, and so I'd hate to speak without knowing all the details, but a concern that I've heard expressed by my colleagues, your fiber supplement is nice, but how about if it has antigens that may actually activate the immune system? And so this fiber supplement is more than a fiber supplement, right? Because it also has probiotics in it. That's the Protexin product, and it has postbiotics as well. But that was a question, and so I am if I was a dermatologist, I would have taken the phone and called my friends at Protexin Vet and say, hey, can you
Yeah.
reassure me? I am not a dermatologist. I don't care. I'm okay if there is a little bit of something there, because I feel like I'm not treating animals with food allergy. I'm treating animals with intestinal inflammation, and where
Mhm.
diet has a role to play in this intestinal inflammation, but it's only one of the components at play that can be that can play a role in the origin of
Yeah.
the diarrhea. I have the ability to change that, but the other components would be the microbiome, the immune system,
Yeah.
the genetics of the patients, etc.
Yeah. I
So
think that's
for
a really
me,
good point.
I'm
Yeah.
not worried.
No. Um, Excellent. There's another great question from Sam. I do think it is Sam Taylor, as in the Sam Taylor. I hope it is the Sam Taylor that we know and love. But anyway, well, no, even if it's not, thank you,
Nothing to say
Sam
about
Taylor.
cats. Nothing to say about cats. Dr. Taylor is on the phone.
Um, anyway, great questions. So the question is, many clients are big fans of raw or high protein diets, which are often low in fiber, and they often perceive grain as a negative. I think that's a
Right.
really interesting. Well, actually, on on top of that question, Sam, I suppose the only other thing I would say is the people that are doing those kind of raw diets, if they are truly making them up themselves, they're often quite happy to kind of add additional things. So I suppose you could always get them to put some fiber on top. But anyway, I suppose the question is, what are your thoughts on raw feeding
Right.
and the
So
fiber there?
if I'm trying to remember what, the origin of dogs, and it's certainly I'm way out of my comfort zone here, but it's a question time. So dogs would go and maybe they would kill an animal and they would eat the muscle meat, but they would also eat. Usually these animals are herbivores, right? They would also eat their guts and whatever was in their guts, which in my opinion, is probably going to be a plant material of some sort. And so if we want to go, and I'm going to stop there because, as I said, out of my comfort zone, but I'm thinking that the original diet of a dog was not limited to muscle meat. It might be a bit different in cats, but for dogs, it was everything. And so I personally think that fiber in one way or the other should be part of an animal's diet, even a healthy dog, to keep that dog healthy. And so I don't know exactly how people feeding raw diets go about it, but I guess fiber. Yeah, I also understand that aversion to grain. Grain is bad. Um, we're not talking about feeding grain only to our pets. We're talking about giving them a balanced diet that's going to
Diet,
meet
yeah.
their needs. And so that's where the internist bows down to the nutritionist and say, let them do their work. But there are ways to do it properly. And so just muscle meat is not the way.
Yeah, super interesting. And it is indeed Sam Taylor, feline specialist extraordinaire. So
Hello,
hello,
hello.
Sam. Um, so yeah, really, really interesting. Just a couple of things to finish up, if anyone has any last sort of questions. I did just want to quickly get your quick fire thoughts on you in I forget which case it was, but you talked about doing fecal parasitology, necessarily not necessarily jumping in and doing lots of blood work, and also considering the diet, at that stage. Do you ever just give 5 to 7 days of fenbendazole instead of doing the parasitology? Do you think that's acceptable, or do you always do
Scott, I
parasitology?
used to do that, and I used to give, let's say, 3 to 5 days, or and so
Yeah.
now I live. I'll try to do the short answer. I live in a country where we have issues with parasites such as heartworm, which I know is not the case in the UK. Count your blessings. And so these animals, many of my patients are on heartworm preventative. These are ivermectin, so ivermectin and all the other more recent molecules. So, and those have an effect on GI parasites as well. And so I think that the prevalence of GI parasites in the dogs I see that are on heartworm preventatives is fairly low. And also I said, well, why should I be a good steward of antibiotics and then not care about anthelmintics? I'm thinking giving anthelmintics to animals that do not have GI parasites is probably not the greatest idea either. And I guess maybe our parasitologist at the vet school probably convinced me a little bit, pushed me a little over the edge and said, you know, you should consider trying to diagnose these parasites rather than just treat them. And so in the past, I did definitely the trial treatments with, well, the empiric treatment with antibiotics. Maybe now I'm a bit more on the checking for parasites, and there are some new ways to do it that I like.
And then just really quickly, and this is more from my question, my own interest. What are your thoughts? And maybe it's not a great question to say quickly, but what are your thoughts on using clay-based products in, you know, these sorts of diarrhea scenarios?
Adsorbents?
Yeah.
Like, yeah. And so I don't have access to many of those. And so I don't use them. Does that mean that they're not good? The answer is definitely that doesn't mean they're not good. It just means I'm not using them, so I can't share my experience. And to my knowledge, and you'd have to correct me here, Scott, but there's not a great deal of literature supporting their use overall. But so that's my short answer. So I have no problem with it, but I don't also have little to no experience.
It leads me to say, obviously, our big shout out to Protexin for facilitating and hosting this webinar. They've done do a great job of sort of promoting education in this way, and I think that's really to be commended. And really, our biggest thanks to Frédéric for presenting such a brilliant webinar on, as I said, a topic that I think on face value, maybe you're like, oh, fiber, but so interesting, and so interesting, I think, how far we've come in GI disease over the last 10 years. And, you know, just our move away from antibiotics and our kind of exploration into so many other different areas is so interesting. And there's just so much more for us to understand and learn. So we're scraping the surface, as they say. But thank you very much for your time and consideration. We really appreciate it.
Thank you. I had fun doing it, and thank you everyone for attending.